Hello, in this session of Ask the Orthodontist, we're going to talk about how to prevent the spread of disease when in orthodontic treatment. In everybody's mouth, there is always bacteria. But if you happen to be infected with a virus like a cold virus or the coronavirus, you also have the viral particles that are in your mouth. And one of the ways we prevent the spread of diseases is to keep the bacteria and the viruses that may be in your mouth from getting on other surfaces. Bacteria and viruses can live on ordinary surfaces such as your hands, doorknobs, tables, all kinds of things. Sometimes they can live there for minutes, sometimes it's days, and sometimes it can be weeks. And then somebody will come along and touch the areas with the bacteria and the viruses, and they touch their mouth, they touch their nose or their eyes, and they can become infected. So it's important that we pay attention to what we touch when we have orthodontic appliances and what we do with them when they're out of the mouth. The first thing you want to keep in mind is whenever you're going to place an appliance or after you've taken an appliance out of your mouth, you want to wash your hands, because when you take an appliance out of your mouth, the bacteria or the viruses that are in your mouth are now on your hands. And if you wash them off, then you won't transfer those particles to other objects that you touch. When you have a retainer and you're going to take it out to eat, the first thing you want to do is wash your hands before you take them out of your mouth. If you put them in your box, you want to open your box and put it in the box, and then put this in your purse or your backpack. What you don't want to do is you don't want to take the retainer and lay it directly on the countertop, the cafeteria tray, the fast food tray, or someplace else, because you'll leave it sit there, and then when you're done eating and you pick it up, the table has whatever was in your mouth is now on the table. And if somebody were to touch where you had it on the table and then touch their mouth, their nose, or their eyes, they would likely get infected. So if you always put your retainer in the box before you eat, and then wash your hands, have your meal, put it back in your mouth, and then wash your hands again. That way you will prevent spreading any kind of viruses that you might have. There's another reason why you don't want to put a retainer directly on a table. Somebody else who may have a virus or a bacterial infection may have touched the table or the cafeteria tray or the fast food tray. And if you take your retainer and place it on the table, it picks up that material. And then when you pick it up and you put the retainer back in your mouth without cleaning it, then you've introduced whatever bacteria or viruses that was on that table back into your mouth. The same is true for aligners. As taking a liner out of your mouth, anything that's in your mouth is now on the aligner. If you put the aligner on the table and not in a box, then whatever is in your mouth is now on the table. And anybody who touches the table where your aligner was now has whatever's in your mouth on their hands. So the best thing to do is when you have an aligner, you want to put it in the case just like a retainer, like that, and don't sit it on the table. Another way to prevent the spread of diseases during orthodontic treatment is with proper use of elastics. Whenever you take an elastic out of your mouth, it contains all the bacteria or the viruses that are in your mouth. And what you want to do is either place these elastics in your retainer case, if you have one. If not, you want to throw them away in the garbage can. What you don't want to do is put them on the table, because where you've touched the table with the elastics now is contaminated with bacteria or viruses that may be present in your mouth. Another reason why you don't want to put elastics directly on the table or on a cafeteria tray or on a fast food tray is you don't know what's on that table nor on that tray. Somebody else who has a bacterial or viral infection may have handled it. And if you lay the elastic directly on the table, and you are reintroducing whatever bacteria or viruses that are on that table back into your mouth. When you look at the rubber band and package edge, you don't want to share rubber bands with anybody else. If you go and take an elastic and you are wearing more than one elastic, then you go ahead and you take the first elastic and you put it in your mouth. Then you stick your fingers in to get the second elastic. All the bacteria and viruses that are in your mouth are now in your bag of elastics. And if you give this bag of elastics to somebody else, then you could be introducing the bacteria and the viruses that are in your mouth to somebody else's mouth. And if they give it back to you, and they've done the same thing of taking the elastics out and then putting one in and then getting another one, all the bacteria or viruses that are in their mouth could be in your mouth the next time you take an elastic out of this. The orthodontic wax packet it is meant to be for one person. You don't want to share wax with somebody else. If you take a piece of wax out of the package and you put it on your braces, and then you get another one and you put it on someplace else, and then you take what's left of your wax and you put it back into the package. This pack of wax now is contaminated with all the bacteria or viruses that are in your mouth are now in this pack of wax. And if you give it to somebody else and that person sticks their hand in, the wax that's contaminated is now in their mouth and you've passed whatever you have onto them. If that person uses the wax and in their mouth gets a couple pieces and puts what's left back into your package, and then you come back and you use this package, you're introducing whatever bacteria or viruses that are in your friend's mouth into your mouth. Whenever you have a retainer, it's always important to keep it clean. Simple toothbrush and toothpaste is enough to keep the retainer clean. If you never brush this, then the retainer can be a very good place for bacteria and viruses to live. Aligners should be clean whenever you wear them when you brush your teeth. You can use the aligner cleaner that we normally give you, or you can use a regular peroxide rinse for them. What you want to make sure is that you do clean them in some fashion. And if you never clean this, then the aligners become a very good reservoir for bacteria and viruses that are in your mouth. I hope you found this information helpful. It's everyone's responsibility to help prevent the spread of diseases during orthodontic treatment.